Acid-base disturbances associated with the retention or excretion of carbon dioxide are referred to as respiratory acid-base disturbances. These disorders are relatively common in ICU practice, and a thorough understanding of the potential causes is essential. A respiratory acidosis occurs when there is a retention of carbon dioxide. Carbon dioxide is a relatively weak acid that dissolves in water and can complex with water to form carbonic acid and further dissociate to hydrogen and bicarbonate. Accumulation of carbon dioxide therefore results in an acidosis. By extension, any process that increases the excretion of CO2 relative to its production results in a net loss of acid, and a respiratory alkalosis eventuates. Any process that results in retention of carbon dioxide can generate a respiratory acidosis. A convenient method for remembering potential causes is to work through the chain of the elements of the exhalation process from the central nervous system down. These include the central nervous system. This can include global causes such as depressed conscious state or specific neurological events such as brainstem stroke or Ondine's curse. The spinal cord, such as high-level cord lesions. Peripheral nerves, including pathologies such as Guillain-Barré syndrome. The neuromuscular junction, a multitude of pathologies can interrupt NMJ transmission, including botulism, some snake bites, and other envenomations, and of course, drugs. The muscles of respiration. Various myopathies may result in respiratory insufficiency. A more common cause of respiratory weakness is acidosis, fatigue, and atrophy. Respiratory skeleton. Conditions such as kyphosis may impair respiration, as may pain associated with rib fractures. Pleural space. Massive pleural effusions and pneumothorax may cause respiratory insufficiency. Pulmonary compliance. As work of breathing increases, CO2 clearance falls. Pulmonary and lower airway resistance. Conditions such as asthma and bronchiolitis may prevent CO2 clearance. Upper airway obstruction. Severe upper airway obstruction or obstructive sleep apnea may also cause respiratory acidosis. Various causes of respiratory alkalosis have been identified. In many, respiration is stimulated either due to hypoxia or due to heightened central drive, such as due to toxins or cerebral edema. The immediate response of the body is known as buffering. Changes in proton concentration result in an immediate shift of the Henderson-Hasselbalch equation to re-establish an equilibrium. This limits the impact of these changes. However, the capacity of the system to absorb further change is limited. The body is able to modulate the effect of respiratory acid-base disturbances by creating a competing metabolic process. For example, in respiratory acidosis, the kidney can generate an alkalosis that in part reverts the pH towards normal. Compensatory mechanisms may take some time to develop fully. Initially, relatively rapid compensation may occur and is seen in an acute process, but full compensation is not usually seen until several days after the causative process has begun. For more information on this, refer to the compensation rules tutorial.